Before we look at atrial fibrillation, let's have a look at the basic structure of the heart and how it functions. Here we have a diagram of the heart. As you can see, the heart is split into two sides. We have the right side of the heart and the left side of the heart. Now the two sides are further divided into a top half and a bottom half. So the top halves are called atrium. So we have the right atrium and the left atrium, and the bottom half is ventricles, where we have the right ventricle and the left ventricle. This gives us the four chambers of the heart, as shown here. Now the right side of the body, or right side of the heart here, brings blood back from the body, passes it through the right atrium through a valve here, and into the right ventricle. The right ventricle then pushes that blood to the two lungs, where the blood collects oxygen and then brings it back to the left side of the body here, into the left atrium. When the left atrium squeezes, again it passes it through the valve here, into the left ventricle, which then pushes the blood back out to the body. So you can see here that blood comes from the body through the heart to the lungs, and then comes back from the lungs into the heart, back to the body. And this is how this human pump efficiently provides blood throughout the body on a regular basis. The valves here on both sides prevent the blood going back into the atrium when the ventricles contract or squeeze together. This allows flow of blood in one direction. Now on this diagram you can see these two green areas here, which are nodes that make the heart squeeze or contract, allowing the blood to be pushed through. The way this works is that we get an impulse that comes to this first node, which is the sinoatrial node. When an electrical impulse hits this node, the node sends a wave across the atrium on both sides. That causes the two atriums to squeeze or contract and push the blood downwards. So the blood will go from here that way. Now at the same time as the two atrium squeezing or contracting, that same electrical impulse will go from the sinoatrial node to the second node, which is the atrioventricular node, or the AV node. When the impulse hits this node, that node then generates its own electrical impulse, which goes down the heart and then goes up both sides, as shown here. Once this impulse goes up, it activates the muscles in the ventricles, causing the two ventricles to squeeze. So it's a cyclical motion where the sinoatrial node gets the first electrical impulse, which then generates a wave across the two atrium, which cause the atriums to contract, and the same wave goes to the AV node, which then sends an electrical wave down, which causes the ventricles. Now, that signal from this node to the second node has to be of a certain strength for that node to be activated. And this is important as we move on to describing how atrial fibrillation occurs. So let's move on to the next bit. In atrial fibrillation, there's a problem with the top part of the heart. What happens is that the signals come through to the sinoatrial node, but there are too many impulses generated from this node. So you end up with many impulses coming across, which cause the atrium on the right and left side to carry on contracting in an irregular fashion. The problem we have is that the impulses are not all of the same strength, and therefore not all the impulses that come from the sinoatrial node generate an impulse that causes the AV node to then subsequently cause waves in the bottom half of the heart. And therefore, only a few of the impulses get to the AV node, causing the ventricles to contract. There is therefore many more contractions occurring in the top half of the heart here, in the atrium, than there are in the bottom half, which is the ventricle. The heart rate can increase to over 100 beats per minute, or it can sometimes drop to quite low number of beats, to less than 60. But it's this irregularity in the strength of the impulse from the sinoatrial node to the atrioventricular node that causes the irregular heart rate. This should hopefully now give you some insight into how atrial fibrillation occurs, and as the word suggests, atrial referring to the two atrium, and fibrillation refers to the fact that the top half of the heart, the two atria, are fibrillating but not always generating sufficient strength to activate the bottom half of the heart. With regard to treatment, there is a number of options that are available. The fact that these atria are fibrillating causes irregular blood flow within the heart. This can lead to blood clots being formed, which can then be pushed around the body, leading to various problems such as strokes. Therefore, firstly, in a patient with atrial fibrillation, the GP will consider the necessity to anticoagulate the patient, in other words, thin the blood down, and there are various medications that the GP can provide to thin the blood down and minimize the risk of blood clots forming. The second option is for the heart rate, depending on how fast the heart is beating, is to slow the heart rate down. So again, that doesn't cause complications to the body. The third and fourth options are for hospital services, and this may be down to a process called Cardioversion, which is where a controlled electric shock is provided to the heart to try and regulate the nodes into a rhythmical process again, so that one impulse from the sinoatrial node goes to the AV node, which then passes round the bottom of the heart. That should hopefully get rid of some of these irregular rhythms that are occurring in the top half of the heart. Finally, the other option is catheter ablation, where the area inside the heart that's causing the abnormal heart rhythm is destroyed using radiofrequency energy. After this, there may be a need for a pacemaker depending on how the heart rate continues to beat. So this provides some insight into how atrial fibrillation occurs. There are various websites where you can get further information on atrial fibrillation, but let's now look at a project that's occurring in the Northwest, and Olivia will provide you some further insight. So let's move on.
Atrial fibrillation affects approximately about 5% of over 65s within the UK, making it the most common cardiac arrhythmia. So what is atrial fibrillation? Atrial fibrillation causes your heart to beat at an irregular pace. This could be fast or this could be slow, and it is caused by lots of impulses in the top two chambers of your heart. Symptoms of AF can include palpitations, dizziness, and breathlessness, but sometimes we can see AF with no symptoms at all. It is important to detect atrial fibrillation because of the more serious consequences of which it can cause. We can see a stagnation of blood flow within the top two chambers of your heart. This can lead to blood clots, stroke, and new studies have found a link to dementia. You might ask why we don't screen everybody. The answer is very simple. AF is predominantly a disease of the elderly. As I said before, it affects roughly about 5% of people over the age of 65, but we see this increase to nearly 15% in the over 75s population. It is also in this subset of the population that we see the more serious consequences arising from atrial fibrillation. So how do we go about screening? The Heart Rhythm Project team is made up of specialised cardiology staff and volunteers that are coming out across the Northwest to community locations near you. These locations include shopping centres, leisure groups, supermarkets, GP practices and many, many more. We use AliveCore's handheld monitors, which you can see here, connected to Apple devices in order to record a heart rate and rhythm strip. These monitors generate an electrocardiogram, or an ECG, as it is more commonly known. The rhythm strip goes back to University Hospital South Manchester for analysis. It takes about 30 seconds to record a rhythm strip. We use one finger from each hand placed on the metal electrodes on the AliveCore monitors. This rhythm strip shows the electrical activity within your heart. We will get back to you within 2 to 3 weeks if any abnormalities are found, but if you don't hear from us, you can take it that no abnormalities were found. We screen both men and women over 65 years of age. It is important that you have not been pre-diagnosed with any cardiac arrhythmia or you do not have a pacemaker or ICD implanted. So what do you do if you get an abnormal result? If we contact you regarding any abnormalities, we will offer the correct medical advice. It is more than likely that we will suggest you make an appointment with your GP. Your GP may want to run further cardiac investigations in order to come to a conclusive diagnosis or to optimise some medical treatment. So where can you find us? The Heart Rhythm Project is coming to community locations across the whole of the Northwest. We will advertise all of our screening locations, times and dates on our Facebook and Twitter pages, which you can see on the screen now. You can also check the Middleton intranet or the University Hospital South Manchester website for more details, so please keep an eye out for any updates. If you have any further inquiries, please don't hesitate to contact myself, Olivia Waring, in the Cardiology Department of University Hospital South Manchester on 0161 291 4632. Thank you for your time.